Hello and welcome. This is Dr. Marc VanHoogstraat from Lifetime Wellness Family Chiropractic and Nutrition Center in Oxford, Michigan. And we're going to be talking about diabetes today, specifically type 2 diabetes. And if you are someone who is currently dealing with diabetes, type 2 diabetes, or maybe you've been told you're pre-diabetic, or you've struggled with blood sugar issues throughout your life, or maybe you have a family history or your relatives and you're concerned about going down that path, I want you to watch this video in its entirety. This could very well be the most important video you've ever watched. So I want you to turn off the TV, turn off other devices, and just tune in, because I promise you this literally could change your life. Now, I'm going to share several facts about type 2 diabetes that may truly challenge your current belief or belief system about this terrible disease. And the reason I'm doing this is because type 2 diabetes, in my opinion, is one of the most mismanaged conditions people suffer with. So let me ask you, if you are dealing with diabetes, you've been diagnosed with diabetes, have you been told that once you have diabetes, you will always have it and you will always have to treat it? Have you also been told that type 2 diabetes is always a chronic and progressive disease? Well, after watching today's video, you're going to understand the truth to those questions. And it may frustrate you, it may shock you a little bit, but just understand there are solutions. And it's really not that difficult. So if you're following the current standard medical care for type 2 diabetes, you are virtually guaranteeing its progression. It will only get worse. So I'm going to share with you a handful of truths so you don't have to suffer with this disease like a runaway freight train. And really, I want you to imagine reversing your diabetes. Imagine not having diabetes anymore. So let's get into it. So who am I and why should you listen to me? So like I said, my name is Dr. Marc VanHoogstraat. In the picture there is my lovely wife, Dr. Colleen, and our kids. And we have been in active practice for over 24 years, chiropractic and a combination of functional nutrition, which we started about a dozen or so years ago, focusing on a lot of cellular healing protocols. And with that, we've literally attended hundreds of hours in functional medicine, continuing education. And years ago, we also completed a certified chiropractic wellness lifestyle practitioner program, which really allowed us to dive into lifestyle and how lifestyle not only impacts our health, but our genetics and our epigenetics. So that's who I am. And we've taken care of thousands of patients over the years, and we have a strong focus now in the functional nutrition arena. And that's really why I'm talking about diabetes today, because it is a nutrition issue. It is a dietary problem. So fact one, type 2 diabetes is fully reversible and preventable. I don't care if you have an entire family tree of people with diabetes, you can prevent it, and it is fully reversible. So what do we know? In fact, we have known the cure for diabetes for over 100 years. This is a book by Elliot Joslin, a medical doctor, way back in 1916. And this was based on clinical observations and treating thousands of patients. You see, insulin was not even discovered until 1921. Now, of course, at that time, diabetes was rather rare, and the majority of people with diabetes was type 1, and they generally did not survive very long because they didn't know how to deal with it. They didn't know about insulin yet. But they started discovering type 2 diabetes, which actually they weren't named type 1 or type 2 actually until the year 2003, if you can believe that. It was called diabetes mellitus. And I want to show you, this is literally as simple as it got. This is an excerpt from the book, so it's a little fuzzy. I apologize about that. But on the left is foods that were encouraged and considered great nutritive value. And so we have things at the top like butter, olive oil, and cream cheese, and meat and poultry and fish and eggs. And on the right side are foods that are strictly forbidden: sugars, pies, puddings, flour, bread, rice, barley, oatmeal, macaroni, sweet and dried fruits, honey, sweet wines, liquors, syrups, ale, things that were high in sugar. They didn't realize it was a sugar issue. So this is over 100 years old, folks. So this is nothing new, but it's just sort of been put by the wayside because of modern medical treatments, which mostly include pharmaceuticals. And so when it really started getting bad, I'll explain here in a second. It was really kind of in the 80s, but I love this little cartoon. It's funny if it wasn't so serious. The high carb diet I put you on 20 years ago gave you diabetes, high blood pressure, and heart disease. Oops. Yeah, you're going to see here how the nutrition advice we've been raised on is really what created this surge of diabetes that we have, this really epidemic of diabetes. And we can point it right back to that. So it was literally in the 1980s. In 1980, the dietary guidelines for Americans came out, the first dietary guidelines. And this is when fat was demonized, and everyone was recommended to eat a low-fat, high-carbohydrate diet. And this spawned the infamous food pyramid, suggesting multiple servings of breads, pastas, cereal, potatoes every single day. By the way, that's all sugar. That's not food. And breads, pasta, cereal, and potatoes, these are the precise foods that provoke the greatest rise in blood glucose and insulin. Type 2 diabetes is a sugar disease. More so, it is an insulin disease, period. So here it is. Remember this? We all learned this in school. And the entire base of the original food pyramid in 1992 was 6 to 11 servings of bread, cereal, rice, pasta, sugar. And then just above that to the right, another 2 to 4 servings of fruit, more sugar. And you can see the very small boxes of meat and fat. Really the opposite. That right there, folks, is the cancer diet. So this is where it all began. And we can see exactly the trend when it started. So this is straight from the CDC website. So you can find this online. Go there yourself if you like. I copied it straight from the CDC website on the numbers of people with diagnosed diabetes in the United States. So the bottom are the years, and it starts at 1980. And the numbers on the left are actually in the millions. So we had very few people just in 1980. It's right around 5 million. And you can see right after those guidelines came out, that food pyramid came out in 1992, which is right here. We can see what happens over the next few decades where we spiked up, well over 20 million. Now, currently, the new numbers, we've actually topped. The line continues to go up over 30 million in just another few years right here. So we have been on a terrible trend. Diabetes has just skyrocketed, and we can point it right back to these original dietary guidelines that encouraged us to quit eating fat and start eating all these carbs. So, and by the way, the link between healthy, natural, saturated fat and heart disease has been totally proven false. Fat is your friend. Eating fat will not make you fat. Eating fat will not clog your arteries. Eating fat will not make you have a heart attack or a stroke. In fact, the research is clear. Eating carbohydrates will do all that. And the most recent dietary guidelines for Americans that came out in 2016 quietly removed the restrictions on dietary fat. No fanfare on that. It's just quietly removed. No more mention about fat and removing it, but still encouraging people to eat plenty of carbohydrates, a lot of that refined carbohydrates. So this is where we are. Fact 2, type 2 diabetes is caused by too much sugar and too much insulin. I mentioned that earlier, and it boils down to that. It's as simple as that. You're just so full of sugar, which causes insulin to rise. So we're going to break this down a little bit to help you understand, because when you get this, you have the solution to get your health back, to get your life back. So on the left, we see kind of a normal scenario where You have glucose in the bloodstream, and insulin gets released, and insulin, what it does is it tells the sugar to go into the cell, and then the cell can use the glucose for energy to make things do what that cell is supposed to do. So on a normal level, normal glucose levels and normal insulin sensitivity levels, there's a happy balance there where the cell gets what it needs to work, but we don't have too much excess glucose in the bloodstream. That's the scenario on the right side under the insulin resistance. Now this is an interesting little couple paradigms here that reflect the current outlook or the current mode of treatment in medicine. So if you look at the one that says internal starvation paradigm, here's a situation where we have a lot of glucose in the bloodstream, but we don't have the glucose getting into the cell. So either that cell is insulin resistant, meaning it's not listening, and so there's no sugar getting in the cell, or in most cases with this particular scenario, there's not enough insulin. So this would be indicative of like a type 1 diabetic, where they're not producing enough insulin or any insulin at all. So therefore, the cell is not getting the message to get the glucose in. This picture to the right is really a more accurate depiction of type 2 diabetes. And I'll share with you one of the contradictions that we have currently in the medical treatment. So here we have a situation where we still have excess glucose in the bloodstream, but the body's cranking out insulin like crazy and just forcing the glucose into the cell. So now we have a cell that is actually becoming toxic of too much glucose. And there's still a ton of glucose in the bloodstream. So this is where you'll have elevated blood glucose levels, a lot of oxidative stress and inflammation in the body, and eventually you start to develop more fat and get fatter. But what's happening in a lot of cases when patients go in, all that's being measured is the glucose numbers. They're not even looking at insulin numbers. And so this is where you get put on glucose lowering medications, or you get put on insulin itself, and because the doctors are thinking this is what's happening. They're thinking, well, you got so much glucose in your bloodstream, your cells are going to starve. So we got to lower that glucose, blood glucose. We got to get it into the cells. When that's not what's happening. That's what's happening with a type 1. This is type 2 diabetes here, where you are so full of sugar, your body is cramming sugar into every cell it can that can take glucose in your system. So type 1 is a disease of too little insulin, not enough insulin. And insulin became a totally life-saving intervention after it was discovered, because now these people, without it, your body literally starves and eats away at itself. So those people early on with type 1 diabetes, couldn't gain any weight. They would be really skinny and they would basically wither away and die. So they needed insulin. Well, type 2 diabetic, yes, they have too much sugar, but they also have too much insulin. And what do? We give them more insulin. And so we're trying to force all this glucose into the cells when they're already packed full of sugar. And I want to talk a little bit about sugar and its effects in the body, but we'll come back and revisit this a little bit later. So there's some interesting things that you may not know about glucose or sugar. And so one of them is there's a relationship between glucose and vitamin C. They're very similar molecules. And in fact, humans don't produce vitamin C, so we have to ingest it. If you're too low on vitamin C, that's when you get scurvy. That's sort of been a disease of the past. Not many people, develop scurvy anymore. But other animals that don't require vitamin C make vitamin C from glucose. So it's very similar. And being similar molecules, vitamin C and glucose use the same receptors, the same doorways or gateways to get into a cell, particularly a white blood cell, like a phagocyte or a lymphocyte. This is why vitamin C helps you if you have a cold. You take a bunch of vitamin C, your immune system cells work better because they require vitamin C to be effective. Well, if you have really high glucose levels, you have a lot of sugar in your system, those glucose molecules are going to take up those receptors, so you're not getting the vitamin C in your immune cells. So there's something that can be measured that's called your phagocytic index. This basically is how rapidly a phagocyte or a lymphocyte will eat up or devour a virus, a bacteria, a cancer cell. That's just how our bodies protect us from these things, and it's called the phagocytic index. Well, with a blood sugar level of 120, which is you're in insulin resistance area, you're not even diagnosed as diabetic yet, you reduced your phagocytic index by 75%. So your immune system has taken a huge hit with elevated glucose levels. Another thing about glucose, and this kind of goes back to the dietary recommendations, because when it was first recommended to start cutting out fat, eat a low-fat diet, especially what kind of fat were we told not to eat? Saturated fat, right? Well, when our cells get full of sugar and we've maxed out our glycogen supplies in the liver, in the muscles, and in the cells, the next thing your body's going to do is it's going to start to store glucose in fat. It's going to make triglycerides out of glucose. It's going to store it as fat. Guess what kind of fat your body stores it as? A saturated fat called palmitic acid. So here we are, we recommended to eat all these refined carbohydrates and low fat, and what does our body do? It turns it into saturated fat, the very thing that we were told to avoid. So it's just, it's terrible advice. Now, when we look at insulin on the other side, and we talk about things like insulin resistance or hyperinsulinemia, where there's just too much insulin. Insulin is really a unique hormone in the body, and it's one that, when we look back historically, just in human nature, it wasn't called on all that often. Now it's just a whole different ballgame in modern dietary intake. But insulin primarily is a nutrient storage hormone. So it does a lot more than just reduce blood sugar, but what it's doing is it's storing sugar in the cells or in the liver. So it's storing it for future use. And when those are maxed out, it's storing it as fat for future fuel. Fat is kind of the preferred energy source in the body, and so fat cells are like long-term storage of energy. Very easy to tap into as well when we need it. But insulin also helps to store and affect the supply of other nutrients. Take, for example, magnesium. Well, if you develop insulin resistance, we then tend to lose magnesium. We lose it out of our system, and magnesium is critically important for muscle relaxation. So if you look at something like the cardiovascular system and your blood vessels, with low levels of magnesium, you will have an increase in your blood pressure. So when you look at a diabetic patient, many of them have cardiovascular issues like elevated blood pressure. Many of them are on medication for blood pressure issues. Let's look at another one like sodium. Insulin will actually cause the retention of sodium. And of course, that causes the retention of fluid, and in the cardiovascular system, that can end up leading to congestive heart failure, another very common condition that diabetics deal with. It's all because of insulin. Insulin also plays a pretty important role in hormone production or hormone conversion in the body. So in the liver is primarily where we convert thyroid hormone, T4 into T3. T4 is considered the inactive form. It needs to get converted to T3. T3 is the active thyroid hormone. When that talks to your cell, that's when the magic happens. You feel good, you look good, and all these great things. Well, insulin resistance in the liver is very common. It's one of the first organs that gets affected by chronic elevated insulin levels. And so when we have insulin resistance in the liver, we now reduce our conversion of T4 to T3. So now you can start to express symptoms of like hypothyroidism. Another major impact insulin has on us, it is considered a mitogenic hormone, meaning it causes your cells to reproduce or replicate at a faster rate. So another term for that is accelerated aging. So if you have chronic elevated insulin levels, you are going to age much more rapidly. And also, if cancer cells can get impacted by this as well and start to replicate and reproduce more rapidly. So some not so fun things there going on when we have a lot of glucose and a lot of insulin in our system, some of the negative effects. So think about it this way. Sugar is not supposed to be your primary fuel source. Sugar is really meant to be your body's turbocharger. Fat is the main fuel source that our body really, for centuries, has thrived on. So we store fat as triglycerides, and those get broken down into ketones. You see, you only have enough stored sugar, which we call that glycogen when it gets stored in the liver and in your muscle tissue. You only have enough stored glucose to last you one day. And now, if you're exercising on that day, it's not even going to last you that full day. But we have weeks or months of fat available for fuel. So we've been thinking about this kind of backwards. Fat is the primary fuel source. Sugar is just there to kind of get us by when we really need to tap into it, or we need to really we need immediate energy, but we're going to run out of it pretty quickly. So we weren't designed to be living on sugar. We run out of it very quickly. The body's good at using it, and every cell, most cells in your body can use sugar, but fat is where the magic is. So think of glycogen or glucose as your wallet. We want money in there, and we want to be able to access it easily, but it is kind of limited. There's only so much you can put in your wallet. When we look at fat, think of fat as like your bank account, where it's maybe not as easy to access. You got to go online, or you got to, go to the ATM, but virtually unlimited amount of resources can be stored. So we like to have the wallet available, but we don't like running out of money. So we want to fill that bank account. And so we want to be able to tap in and be more fat adapted. So here's another fact. Type 2 diabetes affects every organ in the human body. And this is where things really get dangerous, because type 2 diabetes really is kind of a gateway to many other chronic illnesses. And the fact is, if you have diabetes, like, you literally get to leap to the front of the line for risk at developing things like blindness and kidney failure and heart disease and stroke and amputations, dementia, infertility, nerve damage and neuropathies, and even things like Alzheimer's disease. Did you know that Alzheimer's disease now in the science is referred to as type 3 diabetes, because it's a sugar and insulin issue in the brain? So, this is where I'm telling you, diabetes, and it is no fun. This is not a disease you want. It's created because of too much sugar and too much insulin in your body. But the great news is it is rather easily addressed and rather easily reversed. There are some steps, that need to be followed, but working with the right doctor, the right health coach, laying out the right path, this can be, reversed and corrected. So another fact, type 2 diabetes, well, like I just said, reversible and preventable, but you can do it without medications. So here's where it gets a bit frustrating, especially, if you're someone working in the holistic field or more natural remedies for people, because modern medical treatments are solely and strictly targeted at reducing blood sugar levels. So what's very common is diabetics will, they'll be testing their blood sugar themselves at home, probably pretty regularly, but the doctor's always going to want to look at their hemoglobin A1C levels, which is basically a 3 to 4 month average of your blood glucose levels. And I can tell you from looking at lots of labs and blood work for patients that I take care of, rarely do I ever see insulin checked. They're always just monitoring their blood sugar levels. And that's where a lot of the medications are all about reducing blood sugar levels. And they do it in a couple ways. There are some medications that increase your insulin levels so that they can help push more sugar into the cells. There's also something like metformin, which acts a little bit differently. It reduces what's called gluconeogenesis via the liver, so you're not producing as much sugar in your system, but it really does nothing to get the insulin levels down or to restore insulin sensitivity. And then, of course, many patients will progress through one medication to 2 medications, maybe even 3 medications, then ultimately they're put on insulin injections, whether they're daily or weekly. And that is just the pattern. That's almost expected. That's how the conversation goes. If you're being treated, by your medical doctor, that's pretty much it. It's a disease of insulin resistance and hyperinsulinemia. that is what's rarely looked at or addressed. It's all about the blood sugar numbers. So you can have type 2 diabetes and have normal blood sugar levels because you're on the medications or you're taking insulin. But why are you getting sicker and sicker and sicker? The core issue is rarely addressed. It's about insulin. So this is an actual thing. In Japan, they're called train pushers because they're so congested with population that these subway trains pull in, and you can see the line of people. Picture them as like glucose molecules in your bloodstream. And here come these train pushers, the guys in the suits and the hats right there. They literally shove people into the train and pack them in there as much as they can, as tight as they can before the doors shut. And this is what's happening with a type 2 diabetic, on medications and on insulin, is there's so much sugar in their system, and insulin is on the scene 24/7, and they're pumping out more insulin and just trying to cram as much sugar into their cells as possible to the point where it's just overflowing and it's overspilling. And when that happens, that excess glucose then gets stored as fat. And this is why, insulin is one of those hormones that will, being a storage hormone, it's going to store glucose as fat. Now, another interesting thing about insulin, we have a handful of hormones available in the body that move glucose into the bloodstream to be available for fuel. Cortisol is one of those, human growth hormone is one of those, glucagon is one of those. So we have a number of hormones that actually dump glucose into the bloodstream. Insulin is the only hormone in the human body that moves glucose out of the bloodstream. So again, most of the history of humans, it was all about, okay, we need energy, we need fuel, we're kicking in fight or flight, we need glucose so that we can, do what we need to do. So we had backup systems that could dump glucose into the bloodstream. Insulin is the only one that stores it. So it was designed really to not have to be tapped into all that often, and because there's no backup for it either. But now with the current, modern American diet, there's so much sugar in the diet that insulin's on the scene many times nonstop around the clock. So the fact of the matter is, insulin sensitivity will determine how long you will live and how healthy you will be. Insulin literally plays a role in your aging process. And virtually every chronic illness that people deal with, insulin is on the scene and insulin is playing a role. It's all about the insulin. Insulin determines the rate of aging more so than anything else we know of. So, what's the solution? Well, in our office, and certainly many other doctors around the country and people, looking for real solutions, what we use, we call it a high-fat, low-carbohydrate, moderate protein, insulin-friendly lifestyle. So what does that mean? That incorporates strategies and the science behind, certainly diet and nutrition, diet variation, intermittent fasting, block fasting, exercise, autophagy, stem cell production, sleep, detox, etc. There's a number of things in our lifestyle that impact insulin levels. So it's primarily the diet and nutrition approach is a big part of it, but there's other areas of people's lives, and this is where working with someone who knows, how to approach this and knows what to look for is important, because there are things like exercise that can help with insulin sensitivity and sleep and detoxification, things like that all play a role. And so this is what we teach in our office, whether I'm dealing with someone with weight loss resistance issues or some other hormonal imbalances, or they're diabetic, or they've got an autoimmune condition. This high-fat, low-carb, moderate protein, insulin-friendly lifestyle really helps get their body back into a hormone sensitivity state and decreasing inflammation, and restoring good cellular health and cellular function. So this is straight from the American Diabetes Association website. I pulled this last month in March, a year ago, March 2018. So people with diagnosed diabetes incur average medical expenditures of almost $17,000 per year, of which almost $10,000 is directly attributed to diabetes disease itself. And people with diagnosed diabetes on average have medical expenditures over 2 times higher than what they would be without diabetes. And, certainly this is going to vary depending on maybe someone has a different insurance policy that helps cover certain things, or, other people, maybe they've been dealing with diabetes for 20 years, so their expenditures are much higher. But this is on average at least $10,000 a year this diet and nutrition disease is costing you. It's terrible, and it's one of the top causes of bankruptcy are diseases like this. So I want to quickly just share with you a couple cases recently, just to give you an example of what's possible. So the first case was a gentleman, 71 years old, chronic type 2 diabetes, a lot of cardiovascular and heart disease issues, on a couple different medications for that, very overweight. I believe when he first came in, he was around 265, 270 pounds. And so we got him started on whole, high fat, low carb, moderate protein, insulin friendly lifestyle. And he, in about 5 weeks, his blood sugar went from, it was normally testing in the 140s to 170s. And in his 5-week check-in, we checked it in the office, and it was at 87. And over the course of, I believe it was about 4 months, he lost 55 pounds. And unfortunately, he had a little accident and cracked a couple ribs. He fell. And when he went into his doctor, they were shocked because he was, so much thinner and just looked so much better. He had been a candidate for a pacemaker. But because he was so overweight and unhealthy, they wouldn't do the surgery. And so when he came in after losing all his weight and getting healthy, they wheeled him right in and said, "You're not going anywhere." And they were able to put that pacemaker in because now his body was healthy enough to handle the surgery. So it potentially could save his life if his ticker kind of goes a little haywire. He's got that now as a backup. And another case, a little more recently, another gentleman, chronic type 2 diabetes. That was actually diagnosed secondarily after he was diagnosed with congestive heart failure, but ultimately it was because of the diabetes that was developing. So congestive heart failure, when I saw him, his kidney function was down to 16%. And in fact, the first week after I saw him, kind of really before we got anything going, his kidney doctor that he saw that week didn't like something on the blood test and rushed him to the hospital thinking that he potentially needed to get on dialysis. And when people get on dialysis, it's very rare that they get off of dialysis. So this guy was in rough shape, terrible neuropathy, both feet, could hardly walk, very much overweight, and just unhealthy, and only 57 years old. Been dealing with diabetes for a decade at least. The medications he couldn't take because they messed with his congestive heart failure, so he was doing nighttime insulin injections and just continuing to get worse, year after year. And so pretty quickly he started responding, and real simple strategies that we got started with. Had to go a little slower with him because of the delicacy of the kidney issues. But what happened rather quickly was he lost about 25 pounds. Blood sugars, when he would test them, he would typically float between 200 and 300, just terribly high. Again, another one, insulin was just never checked. So he was doing nighttime insulin injections. His blood sugars dropped to about floating between 110 and 130. This is all within a few weeks. insulin he was injecting, normally he was doing close to 50 units that dropped to 14. And after 3 months, he's actually been off insulin. And he's just continuing to implement the steps. He's been back for kidney evaluations. That's all improving. In fact, the imaging they've done, they said your kidneys look pretty normal. They're not at 100% function, but they're actually improving. They're getting better. The neuropathy is still there. He is walking better. You can see that. All the swelling associated with the congestive heart failure, wrists and ankles just completely disappeared. So this guy's well on his way to becoming a non-diabetic, and we'll see what we can do about some of the other stuff. But I just wanted to share a couple of cases where you can see some pretty rapid changes. And so I would just want you to imagine your life without diabetes. Imagine your life without having to take glucose-lowering medications. No more. Imagine your life without insulin injections. And again, like I said in the very beginning, if you are following the current standard medical care of type 2 diabetes, which is medications and insulin injections, you are virtually guaranteeing its progression. Not a chance it's going to get better. You have to deal with the issue. It's too much sugar and too much insulin. So really, honestly, imagine your life with your health restored. Longevity comes back into the picture. You're not worried and concerned about just continuing with chronic illness. It's possible. So what do we do to help people? What's the first step? This is going to wrap up the video today. But we do a functional nutrition consultation, and that can be done virtually through Facebook, FaceTime, or Skype, something like that if you're not local to us here in Michigan. Or certainly if you are, we can set up a face-to-face. We prefer that, but we can help people anywhere in the United States. So functional nutrition consultation, we do a very thorough and detailed metabolic assessment, really helps us pinpoint where major imbalances are in the body and what organ systems are being affected. If you've had any blood work, we certainly review that, and we can also order blood work if something's missing or we feel something would be beneficial. We have access to some incredible labs. A lot of times the labs that we order are ones that your medical doctor either won't or just don't have access to. We do have an in-office inflammation test called a meta-oxy. We do it's a simple urine test. We don't have to send it out or anything. We get the results right here. That can also be sent to people if they're in a different location. And then based on all that, we really come up with a personalized recommendations. There's no cookie-cutter approach here. There are some foundational things that we implement. Some people are ready for stuff sooner than others, but it's a process. The body does take time to heal, but it begins immediately. And then we work hand in hand with our clients, and because it's all about results. That's all that matters. And so we're vested, and we walk you through the process. And really, honestly, it's nothing hard. Certainly, there'll be some changes that you'll have to implement. Otherwise, you're just going to keep getting the same results. But we make it very easy, and just the strategies we implement aren't difficult. They're not challenging. Anybody can do this. And it's really all about just getting your health back and getting your life back. Normally, this is a $295 visit. We usually spend about an hour with each person. But because you've watched this video all the way to the end here, mention that if you call the office, the contact information is right below this video. Call the office or send us an email, and we'll honor that $195. We'll knock $100 off for you just to give you a little motivation to get checked and get on the right path with this. All right, and if you do have any questions, certainly use the email. I'll answer any questions that you have. Just shoot me that, and I appreciate you tuning in, and we'll see you next time.